Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. I'm excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Maigari Jinkiri. He's VP of Business Development at Celebrus. Welcome, Maigari.
Thank you very much for having me here.
Yeah, excited to dive in. You guys are doing some fascinating work. I've seen you at a lot of conferences, so excited to be able to share your all story with the Healthcare IT Today community. In fact, I think our Sway Health community is going to like it as well. But before we dive into today's topics, tell us a little bit about yourself and Celebrus.
Yes. So Maigari Jinkiri, as you mentioned, Vice President of Business Development here at Celebrus. My background was a lot on the consulting side and not necessarily software. So I was a digital data analytics consultant for about 15 to 20 years, right? Helping clients collect data across all digital touch points, whether it's web, mobile, check-in kiosks, working with clients to help set the strategy for the data they wanted to collect, and then obviously how that data would be utilized to drive more relevant communication in the user experience, right? So is it personalization? Is it communicating to call center, customer care agents with the information that they need to be able to provide more relevant communication to the individuals who are calling in, right? And so for us at Celebrus, right, we're a technology company that has existed for 25 plus years, providing digital data collection across, again, web, mobile, and check-in kiosks. So differentiators are really simple for us, right? Unlike some of the other platforms out there, one, we're true first party, right? And so there are no browser limitations, and any of the other fun stuff you've heard about cookie deprecation doesn't affect us. And so that allows us to then tie identity across anonymous and known sessions. Very simple implementation. So it's a single line of code, right? It collects hundreds of data points out of the box. And it allows you to bring in context about the information that's collected. And because we've historically focused purely on data collection and data connection, we've got easy integrations with downstream platforms that will actually utilize that data to drive that more relevant communication, whether it's personalization, whether it's EHR platforms, or whether it's your call center platform. Taking that information that we're collecting digitally, whether anonymous or known, and passing it off to information that makes communication for healthcare providers, banks, financial services, retail providers more relevant and more intelligent.
Yeah. And I want to dive into that in a minute, but I love the 2 points of differentiation that you talk about. Because in healthcare, one, you lose the patient once they hit Epic MyChart, or whatever portal you might be using. But with Celebrus, you can bridge that gap, whether it's a portal, a kiosk, or whatever it might be. I think that's fascinating. And then to your other point, that it collects it automatically. It's not like you have to define and set up all this other information. It just collects it. I think those are powerful things. And I imagine that's what you're hearing from your healthcare customers as well, right?
Yeah, I mean, we're hearing it from customers sort of all over the place, right? It's the data collection, digital data collection is really hard. It costs, hundreds of thousands of dollars a year to maintain because the digital experience is dynamic. You add a new page, you add a new experience, you build a new campaign. That requires kind of new JavaScript tags that go on a site, and those tend to be brittle and they break, right? And so you've got all this time spent, upfront defining requirements and then sort of building code and then watching that code break, and then you've got the situation where you thought you were going to have the information that you needed to make intelligent decisions, and it just doesn't work anymore, right? And so, my history as a consultant, I felt the pain quite a bit. We were responsible for helping clients actually set up data collection, right? And utilizing, the code and JavaScript code and whatnot. And, clients would pay us hundreds of thousands of dollars a year to do that, right? And with Celebrus, those costs are gone. The data is automatically collected, as you said. And so we give you access to that information in real time to deliver more meaningful experiences for your patients.
Yeah. And when you create those custom solutions, you forget that you created it 5 years ago, who did it, what did it. It's amazing how, like you said, brittle they are. Let's talk about the
Absolutely.
digital front door, right?
Mhm.
How do you see that digital front door changing, and how are you seeing organizations extend the patient experience into digital using the data that we just talked about?
Yeah, I'd say the most important thing is to kind of meet the patient where they are, right, in their patient journey. So I would say historically the front door was physical, right? If you're a healthcare provider, a patient walks in the door, goes through, gets an appointment, and walks out the door, and that was really the extent of the patient experience, or the patient experience that the healthcare provider really cared about, right? What we have found, right, is over time digital experience has mattered more to the patient journey than it does today. So, for example, I just recently spoke at CX Healthcare West and was kind of providing, I was doing a little research and was figuring out some of the statistics around kind of the digital experience and what it means to the patient journey. So, 1 in 5 Google searches, or 20% of Google searches today are about healthcare, right? 70+% of patients start scheduling an appointment online. Most patients, well above 50%, are looking at the reviews for healthcare providers. So truly understanding and being able to service the journey, either sort of pre-appointment and post-appointment, is massively important for healthcare providers, both payers and the providers themselves.
Interesting. And talk about that. I mean, when there's someone's looking for care, it's more digital these days. I mean, you gave the stats for that. What are some of the keys to communicating with them digitally, in an effective way that actually makes impact as opposed to, yeah, I was at the PEGA conference recently and they said we need to move from marketing to individual one-to-one patient communication. How do you see that? What needs to be communicated digitally and what are some of the keys to doing that effectively?
Um, yeah, so one's going to be like simplicity, I think is really important. So, if I go to a lot of healthcare providers and recently the show, and I don't know if it came up at PAGA, but a lot of them, they will almost embarrassingly show you their website, and then they will sort of talk about some of the deficiencies. And many of the deficiencies are really with the customer experience. So a lot of them don't necessarily make it simple, right? The communication's not simple, and I understand that can be really, really hard because there's a lot of information you're going to want to convey to somebody who's trying to schedule an appointment or getting education about different treatments, right? The other thing that's really, really, really hard is because of the lack of simplicity, there's going to be some level of frustration. And so this for us as Celebrus, and I think it just goes for providers and payers, you need the information to understand where individuals are struggling as part of this process, right? If there's frustration, if they're rage clicking and they're on your website and all of a sudden they're not able to deliver on what they want, whether it's scheduling an appointment or whatever it might be, and they have to call the call center. That's cost associated with an organization that really shouldn't be costs that they should endure. The website should work the way the website is supposed to work. And if it does, then that call doesn't necessarily get made, and there are costs you can actually take out of the business. I mean, I would say, the other thing is, you need a better understanding of the patient journey,
Mm.
right? Across whether it's treatment, if I'm in treatment for, let's say, cancer, right? Or if there's an expectation that I take certain medicine every week, right? Is there a way we can follow up as part of that? Can we communicate to the person in app to say, did you take your medicine this week? It could be a simple yes or no. Let's say you're supposed to take it 7 days a week. Did you take it 7 of 7? Did you take it 5 of 7? That gives us more information about the patient that helps us understand how to either communicate with them in the future or ensure that they get back on track, right?
Yeah, and it's interesting you say that because if you think of every, healthcare website, they treat a cancer patient, a patient with a simple, cough and cold, or, say, someone who's giving birth exactly the same way. And yet the needs are so different between those different populations. Now, I love that you talk about simplicity, but for me, if I'm a marketer looking at this and I look, for a healthcare organization, okay, campaign marketing seems simple. I do it. I do it the same for everyone, right? Switching to this patient-centric marketing mindset, if you will, that seems more complex. How do you, make that shift, and still keep it simple?
Yeah, I don't think it's purely just a healthcare problem itself, right? So I would say most organizations have historically had a campaign marketing mindset. And so, if you think about just the way that everyone's organized, right? You've got a marketing team, and then you've got, maybe some part of the organization works with email, some with social, some's search, right? And so when you run a campaign, you get them all together, and then you put together a plan and you sort of deliver on, email is going to do this, this is going to, you coordinate there. What we have seen across most organizations is they start with a very detailed journey mapping exercise, right? And so with healthcare, right, it's a patient journey exercise, and it's a topic that showed up quite a bit at CX Healthcare West. And I would say that at any organization I ever consulted with or worked with, one area I would say that was really important as part of the journey mapping exercise, and it's maybe sort of an ancillary benefit, is it requires cross-team collaboration. And in this case, in a patient journey mapping exercise, we're focused on the patient. And there are, as we think about the patient journey, and we maybe think about it, as you mentioned earlier, from a cancer standpoint, from a pregnancy standpoint, what does that look like? Who's involved? Doctors, nurses. What's the digital team doing? How do we build out a better patient journey becomes really important. And it's not just journey around specific treatments. The other thing that I think is really important is to, let's start thinking about age-based treatment, right? It would be, one of the examples I use in some of our one-on-one meetings is like, I'm turning 45 this year, right? This is the year I'm supposed to go in for a colonoscopy, right? It would be great if, one of the healthcare providers I work with today was reaching out to me to say, hey, we know your birthday, we know it's coming up. Do you want to reach out and schedule a colonoscopy, right? That could be something that would be relevant for me. Kind of waiting on that communication. I don't necessarily want to go out and actually do it myself, but if somebody were to pop up in an app or send me an email, I might click through and actually start that journey.
It's interesting. I turned 45 too, and I haven't got the email either. So, maybe Alexa right now is listening and it's going to do that for me now. I
Yes.
don't know, but it's interesting. But if I go and search for colonoscopy on a physician website, they don't customize and tailor the experience either, right? Like, I would have to proactively do it myself. I think one of the other challenges around this is around identity. How do and what does it take to identify a patient at scale, which is actually the biggest problem? Sure, we can do it individually occasionally, but
Mhm.
across all of healthcare's various touch points. I mean, you highlighted 4 or 5 right there: call center, website, portal, etc. How do that's what you guys are working on. What does it take to do that?
Yeah, so I think there's two aspects of this. 'Cause I did a lot of journey mapping as a consultant, and I think there were sort of two states of how I think about journey mapping. One is, what is a journey today? And then what is an ideal journey? And when I say ideal journey, I'm not necessarily thinking of like the fastest way to get through the process, right? I would say, and I would think pretty much everyone in the healthcare industry would understand that identity is not something that healthcare does really well. And healthcare also does not put enough data points as part of the patient journey to help in understanding who that patient is, right? And so, there's a bit of an example that I had in one of our one-to-one meetings. I was meeting with a lady who's in charge of patient experience at a hospital, and what she struggled with. Well, the goal that she had for organization was to increase primary care patients, right, 3% each year. And so the way they defined it was, you are a primary care patient within their hospital system if you've had an appointment within 24 months. Great.
Okay.
And so what she talked about was very specifically, as part of the patient experience, they would get to about 3 months. So in 21 months, right? You haven't been to a primary care physician, and they start spamming you immediately, trying to keep you within the system. And so, one of the things I talked about with her was just as a consulting background, I talked about this concept of like Hansel and Gretel, right?
Mhm.
So if I know what my goal is, right? How do I think of the breadcrumbs that I can put in place earlier to help drive either sort of predictive analytics to say, okay, these are the people who didn't interact with us in the first 6 months. They didn't interact with whatever this message that we might have sent, an email we might have sent to them. And that could be in a sign of increased recidivism, right? And moving out. So what are the things we can do sort of early on in the process to not only identify, set up interactions, that then will help us understand how to deliver a better patient experience individual, but also understand who we should be sort of contacting, approaching, and making sure that they're either following protocol, they get the information and the education they need to stay within a healthcare system without moving away from that healthcare system. That's the other thing that I think healthcare systems are sort of are trying to fight here is it's almost a fire and forget it, right? You come in, you're treated, and you leave, and there's really no concept of, or not a great concept of pushing education to say, you were just here for this. We know a few things. Blood pressure might have been high. Great. Let's send you some information on things you could be doing. Let's go in and And then are you doing those things? Are you walking 20 minutes a day? These things I think are really important. And even though we talked earlier about the concept of the digital front door extending, I think there is still room and a gap within the healthcare industry to kind of deliver on that promise based off of better identity.
It's so interesting. Because you're right that many of them they wait that 2 years and then start spamming. I love the idea of the breadcrumb, and then also within that, if someone has interacted with those breadcrumbs, then they're a very different profile and have a different buyer journey than someone that's ignored every breadcrumb, right? Like, and so then you have to personalize it as well. It sounds like that's what you're espousing is this, leave the breadcrumbs so you can personalize better. Is that kind of how you approach it?
Yeah, it increases the knowledge you have about the individual, right? If and when they're so you've sent a message and they haven't interacted. That's a bucket. They have seen, they haven't interacted, could be a bucket, or just never saw it. The buckets, they're giving you pieces of information. So what would I want to know, right? About the individual given where they are. So are you taking the medicine? All right, that's great. Puts you in a bucket here. That's helpful. We know that with the concept of value-based care, it's like, great, we can put this person maybe in a healthier bucket that will then, maybe cost the healthcare system less because they're actually following some of the protocols, right? If we see you're supposed to be taking medicine 7 days a week and you're taking medicine, 3 days a week, what are the things we can do to move you sort of to get you following protocol better, right? I think what we need to do, and we don't really have a clear idea, right, is we don't have a clear idea on who is following what and how well they're following it, which then would provide us with a more relevant way to communicate. So right now, I think in general, in many ways across the patient journey, the healthcare systems, both payers and providers, are flying blind. And those breadcrumbs allow them to fly a little less blind and to be a little more intelligent about how they communicate to each individual on a one-to-one basis, as you mentioned.
Yeah. And to your previous point, maybe they didn't visit the website at all, but they log in the portal, twice a week to check their meds or to schedule appointments or refill. If you don't have visibility into that, a lot of marketers all are just taking the data from their website, not their portal, not their, other sources. So I think
Mhm.
going back to your previous point, that's a good one. You
Yeah,
know,
and
Go
just
ahead.
adding to that, right? This goes back to the siloed question you had earlier. So it's sort of one of those things where, and I'm going to sort of tie it a little bit to financial services, right? So most financial services, whether large or small, got a marketing team. They're focused on the pre-logged in experience, right? And then you've got a different team that's focused on the post-logged in experience. And so what was always interesting is that they had two very different discussions. Um, they cared about very different things, very different KPIs. They didn't really talk, right? So talking about going back to the whole patient journey mapping, forcing some level of collaboration within an organization, didn't really talk. And the data points were needed to be passed from one side to the other.
Mm.
It would be great if the team that handled the portal data knew what that individual might have been searching about, yeah, on the site without actually logging into the portal, right? So there's all these places for collaboration that I think the concept of thinking about the patient journey, thinking about identity, forces collaboration that makes organizations smarter and obviously enhances the patient experience.
Yeah. Talk to me about this idea of kind of real-time personalizing, which is kind of, I would say, a summary of what we've been talking about is this real-time personalization of the experience for patients. How are you seeing providers and payers that you're working with going about kind of this personalization? Any examples that kind of stand out of them actually doing some of this stuff?
Yeah. So I mean, one of our clients, Texas Health, they started the process with us and they built a spreadsheet and it has about 40 to 50 different personalization use cases. And that's what they wanted to deliver. It was part of the ROI model to sell, our platform internally, right? And so a lot of them are focused on what I think other industries might think of as simple use cases, but are not necessarily maybe that widely utilized in the healthcare industry. But they also provide a more relevant customer experience. So, a couple of examples that we use and I call them like small P personalization versus sort of big P personalization. So if, and I've got sort of actual spreadsheets or sorry, actual PowerPoints that I put together as part of the presentation. But it was, in the first session, somebody comes in, they're anonymous, we don't know who they are, and they click through the pregnancy page, gone a couple pages in, they leave, they come back. The question then you'd ask yourself is, what would I be able to provide that individual based off of what I know about them? Well, great. There are a few examples. It could be, hey, utilize one of our hospitals to schedule your appointments, right? To deliver the baby, right? It could be, the next piece there could just be like, hey, find an OB/GYN if we think you might be early in the process and are looking for some support, right? Or it could be maybe they want education. And so we've got a pregnancy checklist that we say, go in, get some education, maybe print this out and put this on the fridge so you have it in place and make sure, especially if you're a first-time mother and you're far more anxious and a bit type A about the process, right?
Mhm.
So I think that's a piece that's really important. If you go through and you start an assessment and you haven't finished it, we can sort of follow you around within the session and say, hey, finish the assessment, right? That's little things like that are the relevancy that doesn't exist with a lot of providers today. And then I think from a payer standpoint, as actually an example, I was looking at my payer website, right, that I have through Celebrus. And I don't spend much time on the website there, and if I do, it's typically claims and whatnot. But I noticed they had like a wellness reward. All right, so the wellness reward is, from what I can surmise, because I didn't really click through, to about a couple of pages, is you get rewarded for exercising and doing things that are positive for your health. Well, as a payer, if I'm looking to reduce the amount I pay to the system because there's absolutely monetary value there, why would you not have been pushing me to sign up knowing that I haven't signed up for that yet? And it would be something that would benefit both of us in being able to lower their costs, right? And then for me, ensuring that you also have more data points, right? We're talking about the breadcrumbs. So I'm going in there and I'm maybe daily putting in like what I've exercised, what I've done. Those are breadcrumbs that allow them to better identify kind of who I am, where I am in the exercise journey. And maybe if I've taken, a couple months off, they can sort of reach out and say, what's going
I'm
on?
back.
Do you have an injury? Like, you have a bad back, you're 45, do you need a chiropractor? Whatever it might be to give me a little bit of kick in the butt to become a little bit healthier.
Interesting. I like those as other breadcrumbs. That's yeah. I don't think people are using the wellness journeys that way. That's a really interesting idea. And I love the personalization on the website. My question for you though is how do you kind of balance this personalization with privacy and, to for lack of a better term, not being too creepy, right? Like, we all are afraid of the creep factor, right? We love personalization when it works well, but we don't want to be too creepy in our patient marketing efforts. How do you balance that?
Yeah, I mean, I think that healthcare is in highly regulated industries like healthcare and finance. It's really, really important. And I know marketers don't necessarily like it, but I do think you have to involve legal the entire step of the way, right? And they can be, I would say, hindrances, right? But they can be your best friends if you can explicitly describe to them what you're trying to accomplish, what you're doing, get their sign off. That allows you then to be more flexible in future campaigns because they understand if the campaign is very similar to one you've done before, it's very easy to explain to them, what you're trying to do. I mean, I think with the regulations in healthcare, that's something that's massively important with being limited in the paid media that you can buy for specific illnesses and all that other fun stuff. But I mean, I think right now healthcare is so far behind from a data maturity standpoint and a personalization standpoint too, that the little things count. And I think those small use cases, those little use cases aren't necessarily creepy because if you compare what healthcare is doing versus what I would see in it if I went to Amazon, right? Amazon is far creepier when it comes to personalization than most healthcare providers would be today.
Interesting. That's a good comparison. Is there something you would suggest to a healthcare organization, provider, payer that what's the first thing to step? Is it doing those journey maps and kind of assessing, and getting the data, the breadcrumbs, as you will, if you will, to be able to understand the journey and then revising it? Or what would you suggest as a kind of a first step for healthcare organizations that want to create this more personalized journey?
Yeah, I would say it's twofold, right? When I was helping clients with sort of large strategy projects, one of the things we tried to build in was kind of a crawl, walk, run approach. And so, what I would say is a journey mapping exercise can be very political and can take a long time, especially given the collaboration or cross team collaboration we talked about earlier. So,
Sure.
while that is an important part of the process, I think there's sort of parallel things that you need to be doing as an organization, right? So I think number one, and one of the things we talk about when we discuss Celebrus as a platform to our prospects and clients is getting us up and running and having us build those profiles is massively important for you because we build and we can stitch profiles, anonymous profiles over time. And if somebody comes back over the course of 2 years and in 26 months they actually log in, we can stitch that entire history together. So having that information available as the backbone for the use cases you want to deliver around personalization and communication is important, right? And that's the foundation for it all. Really, the second piece is as you start thinking about patient journey mapping, think about the um, integration points in a journey that would be relatively easy to deliver personalization for, right? Or relevant communication. So, if I looked at what Texas Health did with us, right? For them, the story was let's build these 40 use cases, then let's build a cost benefit analysis. And in the cost, right? If it requires integration of 4 platforms, right? The cost is probably going to be too high while the benefit might be low. So let's think about not just cost, but complexity and being able to deliver on a use case, because what you want to be able to do is go to your, whomever your boss is to say, hey, while we're working on this really sort of longer process, here's the value we've been able to deliver in the interim. Is it, a bit of personalization on the website? Is it, buying paid media more intelligently? And then, the other piece that I think is when we talked about flying blind earlier, some of our clients like HCA, those organizations, they saw the letter that the HHS put out, and they said, okay, we've got to figure out an alternative to Google Analytics or Adobe, right? And tracking. And so for a lot of them, we're flying blind, and they didn't really have access to the information. And for Celebrus, we started off as a very we started off in regulated industries like healthcare and financial services. And so for us, the concept of security and privacy is just built within our platform. And so unlike other like data trackers, we can also get up and running really, really quickly because, we'll sign a BAA with no red lines, right? We're HIPAA compliant, right? And so for us, it's also relatively easy to get stood up as part of the backbone for long-term patient journey mapping.
Yeah. Maigari, this is fascinating. I love the work that Celebrus is doing to gather this data. I mean, we know data is gold. We apply
Mhm.
that all throughout healthcare, but I don't think we see it as much on the touch points that you're talking about. So appreciate you giving us some insights into what's possible and what healthcare organizations are doing. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Maigari.
Thank you very much for having me. Appreciate it. Take care.